I'm Daksha Trivedi from the Centre for Research in Public Health and Community Care, School of Health and Social Work. 6 months ago, when the pandemic became real, now feels like a lifetime ago, we have been learning to live in a changed world, a world where our health has been in crisis and where mental health matters. But we as a human race have been there before. We have lived through many pandemics throughout history. We have been exposed to constant change throughout our evolution. However, we as a species of Homo sapiens, to survive, we were required to adapt. And the history of human evolution tells us that we have got the tools to adapt to a changing environment. For us, it became the law of life. The whole nation has been trialing many strategies for change, activating positive change in life, changing our mindset, what is important in our lives, and focusing on living a balanced and a healthy life. We know that COVID-19's global impact has affected political, economic, environment, health, education and research. Each of these can impact on our health and well-being. And all this has been scary. At the same time, it has got us to think about how we adapt to change as we begin to live in a changed world. The nation has engaged in creative activities, virtual games, virtual tours, virtual theatres, online exercise for families, music orchestra, quizzes, art and drawing, and many more to keep everyone living life again in a new world. In fact, back in history, we the Homo sapiens species, for example, we painted our stories as a way of communication, thereby growing our cultural evolution. So the way we communicate with each other and the world is changing. In this session, I would like to present what has been a changed world for me, both in my research at this university and also in a personal context. Let us consider health and well-being. Many people have already been living with mental health problems, which has been a growing public health concern. Families and parenting, affecting children and young people, older people aged 65 and over, many people receiving no help, working conditions affecting mental health, young people, up to 20% of adolescents suffering from mental health, and many not able to access appropriate and timely help. And with the COVID lockdown, the mental health has worsened, especially in young people, those with lower household income, those diagnosed with mental illness, living with children, and in urban areas, and the Black and minority ethnic communities, resulting in a widening of pre-existing mental health inequalities. At the university, I co-lead the READY trial, a randomized controlled trial of energetic activity for depression in young people. It is evaluating the effect of exercise on depression in young adolescents aged 13 to 17 years old. The READY trial team is based in the School of Health and Social Work and Life and Medical Sciences at the university. So there's a high prevalence of depression among adolescents, more girls than boys. We know that the rates have increased over the last 3 decades. We know that LGBT communities have higher rates of depression and anxiety, and that depression does result in poor outcomes with a huge burden to services and families. There are long waiting lists for treatment, and there's very little evidence on whether exercise is effective in improving mental health. Our collaborating partners in the READY trial include the University of Hertfordshire, the University of East Anglia, the University of Bedfordshire, and the Child and Adolescent Mental Health Services at each site, together with the community sports partnerships at each site. Referrals and screening are taken at the services, and young people who are eligible and consenting to this participation are randomized to 2 exercise groups, one of a low intensity and one of a high intensity, and a social control with no exercise component. Outcomes are measured at 14 weeks and 26 weeks. The trial has a strong patient and public involvement with the Young People's Advisory Group as well as a stakeholder forum, which is represented by sports organizations, mental health services, public health teams, clinical commissioning groups, and mental health related voluntary organizations. The exercise interventions planned for 13 to 17-year-olds include a low-intensity group, for example, walking netball, a high-intensity group, for example, boxer drills, and a social control group with social activities such as board games and interactive games. To ensure efficient comparison between high and low-intensity exercise protocols, they need to be energy matched to ensure that any differences in results between groups is a consequence of the type of exercise and not the quantity of exercise. All groups would receive behavioral change and motivation education, plus for the 2 groups, twice weekly sessions for 12 weeks delivered by trained exercise professionals. Drivers of poor mental health during COVID-19 have included social isolation and loss of coping strategies, jobs, financial losses, housing insecurity, and of course being frontline workers. With reduced access to services, the READY trial is considered to be timely in that it provides an alternative for young people as an exercise intervention to help reduce depression. So what has happened? With COVID-19 pandemic and a worsening of mental health, all the research activities were put on hold in March. Key processes on the READY trial were delayed, such as approvals, NHS permissions, training and contracts. But there were other impacts too. The schools were closed, sports facilities closed, social distancing restrictions were in place. COVID-19 research became a priority with clinical and research staff redeployed. Recruitment of young people to the READY trial became very challenging. So what did we do? We made some protocol amendments. We considered remote recruitment, an e-consent process by which the young people would be able to consent to take part in the READY trial, online screening measures to identify those eligible to take part in the trial, and we had to think about infection control and the use of heart rate monitors, and the online delivery of interventions, that is the exercise groups, in case we were not able to deliver the interventions face-to-face at the sports centres as planned. Other amendments were online training for the registered exercise professionals who delivered the intervention, and support for clinical research network funded staff who are supporting the study. Against all this, the lockdown has forced us to live in a different way. We at the university have risen well to the challenges we've faced in a new changed world. The university's regular staff updates have provided us with the relevant support during this time, particularly on our health and well-being in a changed world. This has ranged from various toolkits which have helped us through this time, but also opened us to planning in a new world. The Hearts Hub, the Outbreak Plan, the Staff Weekly Q&A, how to look after our health and well-being during COVID, how we pace ourselves working from home, some hobbies and activities we can participate in, and social events and sessions virtual at the university. One of these has been the Vice-Chancellor's Awards delivered online, and for which the READY trial was nominated. The READY trial was planned to deliver exercise interventions to young people face-to-face at sports facilities, but then came the COVID-19 crisis and an ever-changing landscape, We considered how the READY trial could work in this changed world of COVID restrictions, taking into account government guidance of social distancing. We examined all the factors and conducted a risk assessment. Our teams met virtually to examine the impact of COVID-19 on this trial and put forward a recovery plan. In addition, I felt it necessary to look at strengths, weaknesses, opportunities and threats to get a better understanding of our recovery plan. In terms of strengths, I was working in a positive research environment leading this major trial. I was part of an active, strong, collaborative team from various institutions who wished to discuss plans for change. We had support from university, from the funders and the team. Mental health became even more important now as more and more people were looking for support. We knew that the READY trial, one of the largest at the university, provided an alternative intervention to improving mental health. And we remained confident that young people would continue to seek help for depression. In terms of weaknesses, in any crisis, especially with social distancing, we would face the challenge of a dropout. For example, screening referrals for eligibility into the trial with little or no possibility of face-to-face referrals, delay in recruiting to the trial, their cost implications, keeping stakeholders informed and engaged with the trial, the possibility of not being able to deliver the exercise interventions with sports partnerships who were going through their own regulations about delivering exercise during social distancing. We considered the opportunities, and in any crisis there are opportunities. As the quote says, never let a crisis go to waste. Well, having a crisis means we need to think about how to adapt to a new world that we have all started to live in. Opportunities for READY trial included planning online interventions, keeping the collaborating teams together via virtual meetings, less travel, continued engagement of the young people's advisory group and stakeholder events. We could pace ourselves more flexibly at home, self-management and self-care became more important, colleagues being available for support, our partners worked out a way of adapting online screening, taking consent from adolescents to take part, and keeping people informed with newsletters communication. The university prepared us all well to support new students in a COVID-safe environment as it opened. The biggest threat is managing uncertainty. This coronavirus has awakened all of us. The landscape is changing all the time, so learning to adapt our research processes as things change even more. Whilst we have connected more socially with colleagues, family and friends on virtual platforms, the lack of social interaction, uncertainty of return of staff to campus, uncertainty of other normal activities, threatens our health and well-being. For the READY trial, we completed a restart framework and plans for online delivery with flexibility should things change. It was an opportunity to find new ways of planning and conducting our research trial with minimal collateral damage. And I'm delighted to say we have started screening referrals for recruiting participants for this research. In a personal context, I have been through a changed world before COVID-19 lockdown. Mental health in crisis remains, whether it is COVID lockdown or cancer lockdown. From annus horribilis to a changed world and a new way of life. After an aggressive cancer diagnosis and radical surgery, I too had to come up with a recovery plan. I learned to manage uncertainty and fear of the unknown. I had to practice infection control, social isolation, and learn to accept where I was on my cancer journey, looking forward to recovery. I learned to access relevant support, discover new opportunities with a positive mindset. I found new ways of working as I phased back to work. I developed new interests to help my recovery. And self-care and self-management became key to my overall health and well-being. With my passion for research, I looked forward to taking the READY trial forward. In my brave new world, One example of self-care and self-management is making time for my hobbies. Both my cancer journey and COVID period allowed me to continue with my healing art, which was joyful and absorbing, exploring different walks in the beautiful country, dynamic international folk dancing, English, Greek, Portuguese, Mexican, European, and many more countries which challenge the footwork in one who has 2 left feet, out on the green in a small group, socially distant, and even on Zoom. I continued writing about my cancer journey, which is now published to help others. I enjoy helping others by being a cancer advocate and running local cancer support groups. A changed world can be a stepping stone for a brighter future, both in our academic and personal worlds. Thank you.